Yes. Hi everyone. So the other thing that I want to talk about is glaucoma. Now, glaucoma is a very serious condition in our eyes. It is one of the leading causes of blindness worldwide, and it causes irreversible blindness. That means that if you become blind from glaucoma, it is permanent blindness. So what happens is that glaucoma is a painless disease. You do not know that you have it until you have an eye checkup. So if you do not go to the hospital to be checked, you will not know that you have glaucoma. The commonest sign they will find with glaucoma is that one, it causes your pressure of the eyes to increase, what we call increased intraocular pressure. It goes beyond normal. And then it causes optic nerve damage. The optic nerve is the nerve that helps us to see, that takes visual information to the brain. When it gets damaged from glaucoma, then you develop blurry vision and you eventually become blind. Then also it causes your peripheral vision to be knocked off. So the first thing that glaucoma does is to knock off your peripheral vision, what you call visual field loss. So when you go to the hospital, they will try to look for those three things. They will try to measure your pressure of the eyes. They will try to measure, to do visual field analysis, and they will also look at your optic nerve to see if it is damaged or not. The only way of finding out about glaucoma in its early stages is by screening. That means if there is anyone in your family, if there is a positive family history of blindness, someone could have become blind in your family, maybe you thought it was age, or maybe you thought it was witchcraft. It is always good if there is a positive family history of blindness, you go and screen for what? For glaucoma. Also, if there is someone in your family who has ever been diagnosed with glaucoma, it is best that if you yourself should also go and have an eye checkup. I remember a certain case whereby we diagnosed an old man with glaucoma, and his caretaker was his son, who had come to bring him to hospital. Of course, the son still had his vision. So we told this gentleman, sit here, let us also examine your eyes. And unfortunately, we also found him to have glaucoma, but he didn't know. Of course, it was unfortunate that he had developed it, but it is fortunate that we screened him because he had not yet become blind. So we went on to manage and operate him so he doesn't become blind. So this is what we do. When we realize that you have glaucoma, when we diagnose you with glaucoma in its early stages, we have a range of management procedures. Our main aim is to make sure that this pressure goes to normal. We want it to go to normal, down. So we start you on eye drops on treatment, sometimes eye drops and tablets to make sure that the pressure goes down. But the most definitive way of managing glaucoma in its early stages is by operating. You will do a surgery to make sure that the pressure goes down and never goes up. So it is very important that you who is above 40 years of age, if you are above 40 years of age, you are at risk of developing what? Of developing glaucoma. So if you are 40 years and above, please visit an eye hospital and have your eyes checked. But I'm not saying that glaucoma does not happen in people who are younger than 40. We have also seen isolated cases of children who develop glaucoma. There are children who develop glaucoma from birth, what we call congenital glaucoma. In congenital glaucoma, the eyes grow big. You see that the child's eye grow big, what we call ophthalmos. The eyes are bigger because the child has a lot of pressure in the eyes, and the eyes are always tearing. You know, the child is always in pain, crying, and the eyes are tearing because of the too much pain that is caused by what? By the increased pressure. So congenital glaucoma is also one of the leading causes of blindness among children. It is very important that when you see your child's eyes are tearing and they are bigger, they appear to be bigger than normal, you visit the hospital very fast and have your eye checked to rule out what? To rule out glaucoma. Remember these points. When you become blind from glaucoma, it is permanent blindness. And the only way to find out whether you have glaucoma is by screening. So make it an initiative today, or you can make it an initiative this year to make sure that you have an eye checkup at least twice this year. After 6 months, have an eye checkup and make sure that you ask the doctor to to tell you information about your eyesight. Make sure that you find out more information about glaucoma. Thank you so much. Please don't forget to subscribe to our YouTube channel and to like our video and also to share, because this is information that can help a lot of people. Thank you so much. Blessings.